You've finally found the right formula for your baby. Congratulations. It's a huge task and a lot harder than you'd expect it to be. But now you're wondering, how do I actually start this formula? And that's what I'm here to talk to you about today. I'm Erin. I'm a pediatric nurse practitioner and a certified lactation counselor and the mom of two. Make sure to hit subscribe for bite-sized pieces of feeding information for babies from 0 to 2 years. Do you know that more than 75% of babies will get formula at some point in baby's first year of life? So when you need to use formula, or you're exclusively breastfeeding, or you're exclusively pumping and you want to use formula, how do you add it in? Here are the tips that I use to help families transition either to exclusively formula feeding from breastfeeding or to combo feeding. First, I want you to know that most babies do just fine with the switch. But there's a lot of feelings involved, and some of those feelings include guilt, and some of them you're actually very happy about it. All of your feelings are normal and valid. So here are my tips to make the transition as easy as possible. Let's talk first about how we want to add in formula. There are a lot of different ways that families do it and they make it work. So it really depends on your goals. Is your goal to make it to as much breast milk as possible and just add in a little bit of formula? Or is your goal to exclusively formula feed? Because it kind of is a little bit different depending on what you're going to do. Here are the ways that I see families making it work. So some families will combine breast milk and formula in the same bottle, which is totally fine. Some families will breastfeed first and then follow up with a bottle of formula. Some families will breastfeed for all the bottles or all the feeding sessions of the day and then offer one bottle of formula or some formula here and there. And some families will give a little bit of breast milk in a bottle and follow up with a little bit of formula in a bottle, and that is a separate bottle. Or really there are any combinations of that you can think of, because there are lots of different ways to make it work. How do you actually start on the formula? So some families and some babies are just willing to go for it. And so you can just start a formula and they will start taking it. So that would be more of like the cold turkey approach. Or you can do a slow transition, which I tend to like a little bit better because it lets you ease into it. Now, a lot of it will depend on your baby's temperament, and there's no right or wrong way. So it's just what works for your family. A slower transition onto formula can take really as long as you want. So I like to do it a little bit like a stepwise approach. So maybe it looks like day 1 or 2, you give 3/4 breast milk and 1/4 of formula. On days 3 to 5, now I have to remember this stuff and this is a little bit hard. On days 3 to 5, it's 50-50. On days 6 and 7, then it looks more like 25% breast milk and 75% formula. And then after that, it would just be 100% formula. And of course, if you are mixing breast milk and formula, you can stop at any point. That's the desired amount of formula that you want to give. So if, let's say your baby is taking 4-ounce bottles and you want to do some breast milk and some formula, that could be 2 ounces of breast milk and then 2 ounces of formula. Just make sure to make your formula first and then add in the breast milk. It is normal for babies to have some changes in digestion anytime they start on a new food or anytime that they are moving from breast milk to formula. So this is often because formula has iron, so it's fortified with iron, which is an important nutrient for babies' growth and development, but it can make poop a little bit more condensed or solidified. So babies might go from pooping a certain amount of times per day, and that might be consolidated a little bit. Poop often might turn a little bit darker in color, and that is not abnormal at all. Babies should tolerate it pretty well if it's the right formula for their digestion. So I would not expect a lot of gas or discomfort or increased spit up, but sometimes these can happen. It's just something that you need to consider, that if your baby's having a lot of worsening digestive issues, then perhaps they need to go on a different formula. So you can talk to your pediatric provider, you can talk to somebody like me who knows a lot about the formula world and can help find the right formula for your baby. Remember, most formula transitions go very smoothly, and if they're not, I encourage you to trust your intuition and make sure to ask for help. Thanks for watching, and make sure to hit subscribe for more bite-sized pieces of feeding information. Bye-bye.